for today. I've really enjoyed the talk so far. I hope you enjoy this one. So I'm here on behalf of the NSPCC, the UK's leading children's charity, and we believe that child abuse and neglect can be prevented. So I'm hoping that together we can all help to move towards that goal. And what I'll talk to you about today is an important piece of research that was commissioned by the NSPCC and carried out by health economists from University College London. So this is not a piece of research that I myself was involved in. My role really, it was conducted by Conti, Eleni Stephen Morris, and Maria Melnicher, who weren't able to join us today. So my job here today is just to convey their findings in a way which I hope is accessible to those of us who aren't health economists. Okay, so the research The research is about the economic cost of child maltreatment, and I use the term maltreatment here to interchangeably with abuse and neglect. Now, up until recently, no one had done a comprehensive cost analysis of child maltreatment in the UK. We did know several important things. We knew that child maltreatment impacts on young people, not just during their childhood, but into their adulthood. We knew that maltreatment carries many intangible costs, emotional, sometimes physical, and they clearly fall on the individual who has suffered, but those are very hard to quantify. But we also know that there are financial costs that fall on society more broadly, and that's as a consequence of maltreatment or in response to maltreatment. And these are costs to the public purse, and they always have the potential of being quantified if you could find a way of methodology of doing it. Well, why does it matter that we didn't have a cost? A couple of reasons. It matters because we often think of maltreatment, quite rightly, as something that causes great suffering for the individual who has been maltreated. But if we were able to articulate a financial cost and identify the various parts of the wider economy that need to pay for that financial cost, we'd be able to add another dimension to the narrative. We could frame child maltreatment as something that poses a burden not just on the individual, but the broader society and the wider economy. And secondly, it has practical value. If we know the cost of maltreatment, then we know what costs can be averted by preventing maltreatment. So we can use that information to show the economic benefits of interventions that try to reduce or prevent abuse and neglect. So a few years ago, sorry, that would be really loud. A few years ago, the NSPCC took steps to fill this gap in our knowledge by commissioning research to calculate a cost estimate. The researchers from UCL did a literature review to examine what we already knew about the economic cost of maltreatment. They calculated some long-term costs based on primary data from UK datasets, and they pulled all this together to develop a cost estimate of child maltreatment. And I think I'm right to say that this remains the most comprehensive estimate that we have so far for the UK. Their work was published initially in 2017 on our website, NSPCC Learning, but they've recently updated their literature review, and this has been published again in 2021 in various journals and other publications. Now, I don't think there's any reason to eke out the suspense, so I will show you the cost estimates up front. The researchers found that on average, child maltreatment by a primary caregiver costs around £89,000 per victim across their lifetime. So this is when maltreatment does not result in death. If the maltreatment does result in death, the cost is more than tenfold, around £940,000 for every child who dies at the hands of a primary caregiver. Now, there are several things to say about these figures. First, as I've mentioned, there's a separate figure for fatal and non-fatal maltreatment. The presentation is actually going to focus on the £89,000 figure. The other figure is calculated on the basis of health costs associated with fatal injuries. cost of the criminal justice system for perpetrators of fatal child maltreatment, and lifetime costs of lost productivity, and that's why it's called a lifetime cost. And in fact, both of these are lifetime costs, so do not confuse them with annual costs. Third, these figures relate to maltreatment by primary caregivers only, and that just has to do with the way it's calculated. What you need to remember is it's not transferable to harm caused by other people in the child's life. Important to note is that these figures relate to any form of maltreatment, so physical abuse, sexual abuse, emotional abuse, or neglect. The researchers do not disaggregate for different types of abuse, so there's no way of saying physical abuse costs this much, whereas sexual abuse costs that much. It also doesn't distinguish between severity of abuse. So we have one generalized figure, and that covers all types of abuse, one-off abuse or recurring. And finally, this is really important to bear in mind, this is a conservative estimate. The researchers very deliberately chose to base their estimates on data that they could be confident about. And they also acknowledged that they missed out some costs because there were just no available data about them. So these are lower bounds. The true cost per person is likely to be higher than these figures. And to remind you, of course, these costs do not contain the intangible costs, the pain, the suffering. There's no way of quantifying that. So what I'm going to cover for the rest of this presentation is I'm going to talk you through how that £89,000 figure was reached. I won't get into the nuts and bolts. What I think is important is for you to get a sense of where this figure has come from. Next, I'm going to talk about our confidence in this figure, so you can feel comfortable quoting it. And finally, I'll give you some ideas about where and when to use the figure, so how you could use it to best effect. So, how is the £89,000 figure calculated? Now, the researchers had to take into account a range of outcomes of maltreatment, some of which happen straight away after an incident, or in the short term during childhood, or others manifest later in life or through childhood. The evidence review that the researchers did pointed to various immediate outcomes experienced by children, so these informed the short-term costs. But there was also lots of published literature on outcomes that come about later in life. And that was an important reference point for the researchers. But what they ended up doing was a long piece of research where they identified and measured the medium and long-term outcomes in the UK using original analysis. They used primary data from two long-running surveys, the NCDS and ELSA. I'll come on to talking about those. They are both publicly funded, large-scale longitudinal studies, which follow people over time, tracking changes in their lives, in their circumstances, in their opinions, their health, etc. So a closer look at these. The NCDS, that stands for the National Child Development Study. You might be aware of this. It's also known as the Birth Cohort Study. So back in 1958, children born in 1 week that birth cohort was interviewed, or the parents were, of course, when they were little, and that covered 98% of the children who were born that week, so very comprehensive, and the survey has followed up with them, re-interviewing them every 7 years up until the present day. Over the course of cohorts members' lives, we collected information on their physical and educational development, their economic circumstances, their employment, their family health, their attitudes, all sorts of things. And in one of those 7-year visits, the survey asked whether they had experienced abuse by their primary caregiver before the age of 16. The other survey, the English Longitudinal Study of Aging, is a little bit different. It's not a cohort study. It follows a large nationally representative cross-section of society over the age of 50. But it's also longitudinal. So essentially revisits the same people every couple of years. And again, we have data on the individual's physical and mental health, their well-being, their finances, how those things have changed over time. And they were also asking questions about abuse in childhood, although the questions here were a bit more limited. So retrospective reporting of abuse. So what these data sets give us is the ability to identify who was maltreated during childhood, and then to link that up to all sorts of other things that we know about their lives, about their health, about their employment status, all at different ages. Now we know from other studies and research the kinds of outcomes that we can expect from life for people who have experienced abuse or neglect. So from top left, they include things like physical conditions, obesity, hypertension, diabetes, cancer, then mental health issues, anxiety, depression, heavy drinking, smoking, reduced employment, reduced earnings, and disability benefits. And luckily, most of those things were measured by these surveys. So the researchers could see whether individuals in the sample who said they were maltreated experienced any of these health, behavioural, or financial issues. But the researchers were actually very careful in the way that they did this. They knew that even if people in the surveys who were maltreated experienced one or more of these issues, that can actually be explained by other conditions in their lives. For example, they may have come about because of other adverse childhood experiences. For example, their parents might have divorced, they might have experienced bereavement, housing difficulties, and so on. So the researchers wanted to account for those other possible explanations. And when they did that, they found that they could be confident about only 6 of these conditions being linked to maltreatment. And these are the 6. Now, this doesn't mean that other issues I mentioned aren't linked to maltreatment or aren't caused by it. It just means that the researchers chose to be conservative and they focused only on those outcomes that can be identified robustly from the surveys. It also doesn't mean that other people who are not maltreated cannot suffer from these conditions or circumstances. Of course they can. So the researchers calculated how much more likely are the maltreated population to experience these than the non-maltreated population in the survey. And they used that to calculate their costs. And of course the great thing about these surveys being longitudinal is that not only do we know what's happened to people in different times of their lives, but when that effect kicked in. So we know, for example, heavy drinking seems to affect maltreated people from their 50s onwards. Smoking from earlier in adulthood, around 30s. Reduced employment is a significant issue between the ages of 42 and 50. So we know when the costs associated with these issues or conditions start to kick in. So here are the medium and long-term outcomes that were included in the cost calculations. You can see the top few are the ones that we'd seen in the previous slide. Other things like cancer have not been included because they were not found confidently in the data set to be linked with maltreatment. But having said that, the researchers did take account of the knock-on effects of some of those. So smoking, a proportion of people who smoke will go on to have lung cancer. That has associated health costs. So those kinds of costs, days off work, those kinds of costs were included. Some potential outcomes were not included, like drug use, for example, just because that wasn't measured by the survey. But the researchers did include some outcomes derived from the literature, which weren't measured by the surveys, including the 2 in blue at the bottom, social care and criminal justice for perpetrators. Because we know maltreated children will need child protection measures, they may go into care. We know a proportion of perpetrators will go through court proceedings, get convicted, undergo offender treatment, so all of these things have costs associated with them, and these were included. Now, figuring out costs, as you can imagine, is a complicated process. Back one. So where possible, the researchers used UK cost of illness studies to come up with a cost per person. But for some of these outcomes, we only know aggregate costs, so then they had to do complicated kind of divisions by prevalence and by probabilities. And sometimes the researchers had to use proxies. So, for example, we don't know criminal justice system costs for all kinds of abuse, but we know sanction figures for child sexual abuse. So that was used to extrapolate. In terms of short-term costs, essentially a similar process, but not using the surveys, because the surveys weren't helpful in this way. Again, aggregates, proxies, and probabilities for different ages of childhood for these things to happen. Okay, so here are the costs that were calculated for each outcome. Probably too small for you to see, but essentially when both the short-term and the longer-term outcome costs are added up, they come to the £89,000 figure that I mentioned earlier. So it's worth pointing out that the most costly outcomes were associated with social care, with short-term health-related costs, and with reduced employment. So that's how the figure came about. But how confident were the researchers about this figure? Now the authors, Conti, Morris and Melnichuk, were very explicit about this. They are 95% sure that the actual number sits between 45,000 and 146,000, which is of course a very large bracket. And that's what happens when there are so many calculations along the way and each one has a level of uncertainty around it. Now they also acknowledge that they made assumptions at various steps in their calculation, because these were things that they couldn't be certain about. They used a technique called sensitivity analysis to tweak various assumptions in their calculations and to see whether the figure would deviate from the £89,000 estimate. And for some costs, tweaking the assumptions actually didn't make much difference. It made the costs of 10,000 more or less than the 89 figure. But playing around with other assumptions did make a more substantial difference. For example, if short-term mental health problems are more common, or they are less common than they assumed, then the overall cost will be quite different. Or if costs of social care are calculated in a different way than the way they chose to calculate it. And the cost estimates would also be significantly different if it was calculated using different assumptions about what future costs are worth today. That's called the discount rate. So what these two tweaks could mean is that the actual cost may be as low as 57,000 or as high as 150,000 per person. Again, a large bracket, but the overall picture hasn't really changed radically. So, okay, what other data can we bring in to sense check the £89,000 figure? Well, here is one. An estimate that was published last year by the Home Office about the cost of child sexual abuse that involves contact with children. The authors of that paper calculated that the monetary cost of contact CSA is at least £10.1 billion across the lifetime of victims. And what's interesting is that if their estimate for the prevalence of contact CSA is correct, then the lifetime cost per victim of this particular type of abuse comes to an astonishing £89,000. Now it's important to point out that this estimate, the cost estimate that I've been talking about, are wiped out very, very differently. So the Home Office paper includes some costs that the UCL researchers didn't account for, and it excludes the cost of long-term physical and mental health consequences, which the UCL researchers did include. And also estimated social care costs are very different between the two papers. So it's actually really surprising that they ended up with bang on the same figure. But I think the thing to take away from this is that we're in the right ballpark. It might not be spot on, but it's not wildly off reality either. One other sort of piece of sense checking is the lifetime cost estimate for child maltreatment in the USA. Now this was published a while ago, 2012, and as you can see that was much higher than the UK estimate. which kind of makes sense if you bear in mind that the systems in the two countries in terms of healthcare, social care, education, criminal justice are also very different. The costs associated with each of those systems is very different. And also the differences in the way the methodologies used in the two papers. But I guess what's helpful to remember here is that the £89,000 figure was always understood to be conservative. So that represents the lower bound of what we think it costs per victim. Okay, so briefly, how can we use this figure? So if we take as a starting point that we can be confident in the £89,000 figure, how can we use it? Now, as I mentioned in the beginning, we can use it as part of a narrative that presents child maltreatment as something that affects the wider economy and society. There are many costs associated with maltreatment, and there are many economic reasons, aside from obvious moral ones, why we would want to protect children and prevent abuse. And we can also argue that it costs this much, £89,000 per person, to do nothing or little to prevent abuse or ameliorate its outcomes. And that can be a very powerful argument for taking steps to intervene. And this is one example that has done this. This is a report by NAPAC, the National Association for People Abused in Childhood, which took this approach. They used the £89,000 lifetime figure to calculate the annual cost. Remember, that was a lifetime cost. They used it to calculate the annual cost of child sexual abuse. And they multiplied this by the prevalence of CSA, and so estimated that child sexual abuse cost the Treasury at least £1 billion per year. And then they argued that some of those enormous costs could and should be averted by investing in support for young people and adults who live with the consequences of childhood sexual abuse. And their report made recommendations about what that support should look like. So that's one demonstration of what we can do potentially with the £89,000 figure. A second way to use the figure is to make a business case for investing in a specific service or intervention. Now, if you know that your intervention is effective in preventing child abuse and neglect, and you know what it costs to deliver the intervention, you can argue that investing in your intervention makes sense financially because it ultimately saves money. An example of this approach was used in the impact evaluation of the NSPCC schools program, Speak Out, Stay Safe. The researchers there applied the approach in quite a light touch way. So the evaluation of the schools program showed that it had some demonstrable positive impacts on children's understanding of abuse and their help-seeking behaviours. Although I should say we don't know whether that necessarily translates into making disclosures or preventing abuse. Now, we know that there are proven benefits and that these can be achieved by spending a very small amount of money. It was £73.51 per school to deliver the programme. So given how small this investment is, the demonstrable benefits, and the possibility of saving £89,000 not per school but per person, they argued, quote, the potential for the economic return on investment is vast. The second example that I'll mention is in the United States. They're using their equivalent estimate of the lifetime cost of child maltreatment in an even more focused way to calculate cost savings for two parenting programs. So this is a screenshot from the Centre for Disease Control and Prevention website, which hosts a calculator where you can investigate the potential cost and benefit of using one of these services in your local area. And the two services I'm talking about are child parent centres and nurse-family partnership. These programs both have very strong evidence of effectiveness in preventing child abuse, and the costs and benefits associated with implementation are well understood. And what the calculator allows you to do is enter the number of children who will receive the intervention in your local area, and it calculates various things. The implementation costs per child, the number of cases of maltreatment that are likely to be avoided because of the intervention, and therefore the monetary savings across a lifetime that could be made on a societal level if you choose to implement this programme locally. To my knowledge, we don't have an equivalent in the UK, but this is an example of how we could potentially use the UK maltreatment figure to good effect. Okay, so I hope that has been intelligible and useful. Thank you for listening.